My name is Dr. David Emvula. I'm a specialist obstetrician and gynecologist, also a fellow in reproductive medicine. Endometriosis is one of those mysterious conditions in gynecology. It is classified by the presence of the normal uterine lining, which is the inner lining of the uterus, which is usually shed by a woman's menstruation every month, whereby it is now found in the other places other than the uterus. It can be anywhere in the body. However, in most cases, it's found within the abdomen or the area that is known as the peritoneum in the medical terms. So in terms of how this happens, that's why I started to say that it's a mysterious condition. We do not really understand exactly what is a pathogenesis or how it starts, but we believe it has to do with part of the menstruation that goes through the fallopian tubes, which opens into the inside of the peritoneum, and subsequently this then starts growing outside of that the uterus. Why some women develops this condition and not everyone, as we believe that every woman, when they menstruate, there is definitely some part of the uterine lining or menstruation blood goes into the abdomen. We still do not have the answer to this date. There is an element or some theory to suggest that there is some form of genetic linkage, as it has been found in the mothers and daughters and also siblings. So yes, it may be associated with the form of genetic, but when it comes to lifestyle, it is not yet really established if there is really any specific that lifestyle that is associated with the condition on why certain patients develop. All we know is that, like I said, there is some menstruation that goes into the abdomen, but why only a certain patient develops it, and that is where perhaps it has to do with some genetics, but there's more studies that are going on and it is pointing towards that. Symptoms of endometriosis varies from one woman to another. However, there is one common symptoms that are prevalent in most patients with endometriosis. That is one, chronic pelvic pain, and this is a pain that is usually situated in the lower part of the abdomen, and usually this pain is present throughout and it gets worse during the menstruation period. The symptoms the patients will have is also infertility or failure to conceive. So if a patient has been together and they've been trying to conceive, there is a high percentage of patients with endometriosis that have a failure to conceive. The other ones that are also common is pain during sex. When a woman is having a sexual intercourse, they tend to have pain to a point where they even require ask their partners to stop. And in some patients, they may also have some form of bleeding after a sexual intercourse. So these are some of the most common symptoms, but they all vary. And also a certain percentage of the patients may be asymptomatic, meaning that they do not have any symptoms and they go to a doctor and incidentally they are diagnosed with the condition. Most women want to know why did they develop the condition, but even as clinicians, we do not really understand the cause of the condition, so it becomes very difficult. So most of the patients want to believe that it is caused by how their sexual behaviors in their early life, or if they have used any contraceptive or any other medications. The other misconception is also related to infertility, because most patients want to know whether they will be able to have children. It doesn't really mean that if a woman has endometriosis, they cannot conceive or they will not be able to reproduce. With treatment, they will be able to either conceive naturally or they may require assisted reproductive technology. So it does not really equate that if you have endometriosis, you are not able to reproduce or conceive. When it comes to treatment, just to put it into a context, is that there is at least what we call phenotypes. In other words, it is the types of the endometriosis. There is at least 3 types that are well described. One is where they may just have the pain is the main predominant problem. One, they may have ovarian cystic masses on the ovary, and the other one have one which develops more like cancer, where this endometriosis starts growing and even going into other organs within the abdominal cavity. So depending on the patients or the type of the endometriosis they have, the treatment also varies. If it is just mainly purely because of the pain, so these patients can be managed for the pain, although that is also one of the challenging that even with the way they develop the type of the pain, it is not naturally like the normal physical pain that we feel. They may have a different type of pain, which is also known as a neurogenic pain, or more of the brain related pain, and that can also be challenging. So it can be treated. So it's not really to say that you cure the disease. However, the symptoms can be managed. So if a patient has a pain problem, we can control the pain, and the patients can live a normal, healthy, pain-free life. When it comes now to other different types, especially the ovarian cystic ones, and the other one that is invading or infiltrating ones, which behaves more like cancer, although it is not cancer. So with those ones, again, those may require surgical intervention, and this is also the group of the patients that we see a large number of proportion that have problems with conceiving. So in those patients, they may require surgical treatment, where we either drain the whatever blood that is accumulating within the cyst, or we do what we call anatomical reconstruction surgery to try to separate the organs which are affected or invaded by this endometriosis. So it can come in a form of medical, where we just give now painkillers and also hormones, because we know that this is related to menstruation cycle, or it may require surgery depending on the type of the endometriosis. And whether surgery is curative in terms of whether can you get one surgery and you are cured, it also varies. Some patients may require one surgery and they are pain-free and their symptoms never comes back, and you can presumably say they are cured. But in most patients, you find that they get surgery 1 year, and 2-3 years down the line, they may require another surgery. So at the end of the day, the most important thing is mainly to control the symptoms. There is a small risk associated with endometriosis, leading to, obviously we have highlighted one of them is an infertility or failing to conceive, but the serious one, there is an associated between a certain type of what we call ovarian cancer known as clear cell carcinoma. It is associated with this condition. In a very certain percentage of the patients with endometriosis are at risk of developing this disease. And in these cases, it's mainly about us monitoring the patients, and if we see that there is any early signs of that cystic mass showing signs of cancer, then the patients will be worked up and assessed, and obviously then managed accordingly depending on the findings. And the other one is mainly just in terms of the challenges, is mainly the pain that I spoke about. Most patients suffer from chronic persistent pain that continues, and obviously those are the patients that we give the chronic pain medications to help them, assist them with the symptoms. In terms of what patients, women can do with regards to the condition, like I said, it may be asymptomatic, meaning that these are people that are just living their own normal life. It is not really advisable that women should go seek screening or to be just checked if they have the condition. However, if a woman has any of the symptoms that I highlighted earlier, the one is painful menstruation period, or some patients may also just have a chronic pain localized in the lower part of the abdomen, even when they are not on their periods. but that pain gets worse with the periods, then those patients are highly advised that they may seek help from the gynecologist to be assessed, as they may be having endometriosis. The other patients is also those ones that have been in a relationship and trying to conceive, and if they are less than 35 years old for over a period of 12 months and a baby is not coming, or if they are older than 35 years old and they've been trying to conceive for over 6 months, it is also highly advised that they may seek help so that they can be assessed if they have the condition, because as I highlighted earlier, it is the highest percentage of the patients with endometriosis also have a problem with infertility or failure to conceive. So this is most important advice that we can give to the women out there. But in terms of screening, it is not really highly advised that you go and find out whether I have endometriosis or not, but it should be symptom-based, and one should have a higher index on themselves. Endometriosis is a common condition. It is reported that it is present in about 1 out of 10 women, and this number goes up among the women who are struggling or failing to conceive. Therefore, it is highly recommended that if a woman believes that they have symptoms that I alluded to earlier, or they are struggling to conceive, then they must seek a gynecological assessment so that they can be reviewed and they can also be advised on the appropriate management for the condition.